And now looking at the vertebral column and the vertebral bodies, I'm starting with the lumbar vertebra because it is large and it's easy to see the individual parts of the anatomy. And then we can look at the differences within the cervical cord and cervical vertebra and thoracic vertebra that are different. But all vertebrae have some portion of a vertebral body, and that is on the anterior side. And then they all have a transverse process, whether it be small or large, and then a spinous process here. And connecting the body to the transverse process is this pedicle, and it is on the posterior and lateral side. So it's on the lateral side of this vertebral body on the posterior portion of it. So posterior lateral side of the vertebral body is where the pedicle connects the vertebral body to the transverse process. And then connecting the transverse process to the spinous process is the lamina. And lamina is this connection here between the transverse process and the spinous process. And we have some other smaller processes here. We're not going to worry about most of them except for the superior articulating process here. And this allows this spinous process to connect with the vertebral body from above. And there's a posterior articulating process that faces anteriorly so that these two processes can sit and rest against one another. And then within here is the vertebral foramen, also sometimes called the neural arch or the posterior arch. And this is where the spinal cord or the cauda equina and CSF, this is all contained here within the vertebral foramen. And you can see how well protected that area is by all the bony anatomy around it. Here are a couple of images from e-anatomy, and you can see that this is a thoracic vertebral body, and then these are lumbar vertebral bodies. And I want to take a look at the articulating processes. You have a superior articulating process and an inferior articular process, as well as the transverse costal facet here, and that's where the ribs attach. You'll also see those here and here because the ribs attach and then they go around and touch the transverse process as well as the vertebral body itself. And when you're looking at two vertebrae stacked together, as you do in this image down below, the superior articular process of the vertebra, the inferior vertebra, will articulate with the inferior articular process from the superior vertebra. That's the correct way to say it. It's very confusing. But you have the inferior vertebra here and its superior articulating process. That is actually anterior to the inferior articular process from the superior vertebra. So this is a superior vertebra and its inferior process sitting posteriorly to the superior process of this inferior vertebra. So you would have another vertebra sitting on top of here, and its inferior process would attach here posteriorly to this inferior vertebra, but the superior process of the inferior vertebra. So keep that in mind. We're going to take a look at a CT image next through the actual disc space where you can see that articular process. Even here through this disc space, you'd be able to see that articular process. So the processes, we're going to go through these one by one now and state them correctly. They're bony extensions that allow the vertebra to articulate with one another, and that allows movement within the spine itself. And so you have the superior articulating process, and this is the lumbar vertebra L2 right here. And this is its inferior process, but it's a superior process from L1 that's articulating with the inferior articulating process of L2. And this superior articulating process is posterior to the inferior articular surface. So the superior articulating process faces posteriorly, and the superior articulating process, or the inferior articulating process of L1 faces anteriorly. Just keep those things in mind. I know it's a lot to try to comprehend right at the moment, especially when you're looking at it like this. But if you can imagine this a little bit more in 3D, like in those previous images, it will help you thinking about how the processes attach to one another. The transverse process here extends laterally from the vertebral body, and it connects to the vertebral body anteriorly through the pedicle and posteriorly through the lamina to the spinous process, which we aren't seeing here because of the level that we're slicing through. The spinous process is a posterior extension of the neural arch, and it connects with the lamina to the transverse process. So the lamina is a connection between the spinous and the transverse process, not seen here in this image. The vertebral foramen is also known as the spinal canal. Neural arch is also another name for it right in here. It's a protection of the spinal canal. It's sort of a circular formation of the bone, sometimes more triangular in shape. The intervertebral foramen, we're also not slicing through that right now because we're in where the transverse processes are, but if we were down just a little bit lower, you would see that gap where you can see the anterior nerve root and the posterior nerve root and the spinal ganglion as they exit out the intervertebral foramen. And then we have the costal facets, and we're not going to see those because we're at the lumbar spine now, but the costal facets is where the ribs attach to the thoracic vertebrae. While we're in the lumbar spine, we'll just continue on and study the bodies. So again, we've got the vertebral body here connecting through the pedicle to the transverse process on each side, and then the lamina connecting it to the spinous process in the back. They're very large vertebra. There's usually 5, sometimes there's 6 or a non-fused S1. It creates the lordotic curve, so that means the C curve is facing posteriorly or concave towards the posterior side of the body, just like that. Also between the discs here, between the vertebral bodies, is the intervertebral disc, and it is made up of the annulus fibrosus, or this fibrous outer portion, and the nucleus pulposus, which is a kind of a squishy sort of gel-like center. And sometimes people get herniated discs or ruptured discs, and this disc, this nucleus pulposus, will kind of squish out through the annulus fibrosus. This will break down a little bit and go outside the vertebral bodies, and it can sometimes squish forward or squish backwards into the spinal canal. And when it does that and presses on any nerve roots, and that's when you get pain, especially down your legs, or you might have pain in the hips or down into the back. All those things, this area of this intervertebral disc pushing on those nerves can cause a severe amount of pain. I also wanted to point out that this is a great picture from Netter's. This is the posterior side of the body, so you're looking at the spinous processes here in L3 and L4, and it's an easy way to see those articulating processes. So you have the inferior articulating process from L3. It is facing anteriorly, so it's facing away from us. And then the superior articulating process from L4 is facing posteriorly and connecting, and that is where that connection is, and that's what allows the spine movement. So this is another great image of that, and a way for you to look at it to be able to understand how those processes fit together. And up in the cervical spine, we have 7 cervical vertebrae. You can see on this sagittal T2 image, as we talked about before, you can see T2 very easily because it kind of forms this sort of triangular shape. And C2, you can see C2 quite clearly. C1 you can't see as well because it's the atlas and it's a circular vertebra, so you can see the anterior portion, you can see a bit of the posterior portion, but C2 is the axis, and it sticks up through the atlas, and we'll see that in the next set of images as well. We'll be able to see the actual bony anatomy. So you count when you're doing a cervical spine or maybe a thoracic spine, you count to see where you are in the body, and this is C2. It's easy to identify. C2, C3, 4, 5, 6, 7, then T1. It also forms a lordotic curve, just like the lumbar spine, so that means it concaves posteriorly. It has a vertebral foramen within the transverse process, so it's a small hole where the vertebral arteries run through, and we'll see that in the next slide, as well as a bifid spinous process, which means it's kind of forked in the back, and that is for muscle attachments. So let's take a look at the individual cervical vertebra. C1 is the atlas. Again, it's more circular in nature. It doesn't have much of a body to speak of on the anterior side. This is the anterior side, just so you know, and this is the posterior side. So it's, again, they're called I'm having trouble saying that today, tubercles. So there's an anterior tubercle and a posterior tubercle, and they are basically stunted versions of the posterior spinous process and the anterior body that we would have in a regular spine that we saw in like the thoracic and the lumbar spine. But the transverse process has this transverse foramen, and that is where the vertebral artery runs through on each side. Also unique to the atlas is this little area here, the superior articular surface, and that is where the condyles of the skull sit. So you've got the occipital condyles that sit here and articulate with the atlas, and that is how you are able to tilt your head and turn it side to side, is that articulating process there with the occipital condyles of the skull and the superior articular surface of the atlas. And then sitting up here is this articular facet for the dens, and the dens is the articulating surface of C2. C2 is the axis. This is the axis right here, C2, and this is the dens, this little superior articulating process. People theorize that that may have been the body of the atlas at one point in time. And then you have also, you can see this image at on the bottom of how that dens of the axis articulates with the atlas. So you can see how it sticks up there in between the circular area of the atlas and articulates on the anterior surface. So this is the anterior surface of C1, and then the dens articulate. So you're actually seeing this is the anterior surface of this as well. So it actually would be turned around facing the other way, but that's sort of a facet or an articular surface for it to attach here to the atlas. And then you can see on these images here, as you go down a little bit lower, C2 and below have this little bifid spinous process. So it's forked in the back. This is the posterior side, and this is the anterior, the body of C3. And these are for muscle attachments. I realize I may have said it incorrectly before. The dens actually articulates on the posterior side of the anterior arch. This is the anterior arch of the atlas, but this is a posterior surface, and that's where the dens articulates. And then the only other distinguishing characteristic is that when you get down to the seventh cervical vertebra, it becomes much more like the other vertebra, a little bit larger body. The spinous process is no longer forked, no longer a bifid spinous process. It's just one individual process in the back and in the posterior side. And then you have the transverse foramen, and that's where the vertebral artery still is coursing through at that point in time. There are many nice illustrations within e-anatomy of all the different spinous processes and vertebral bodies, but this is a particularly nice one because you can see how the vertebral artery runs up through the transverse foramen here on the side, the lateral side of the vertebral bodies. So that is a very nice image. You can see how the person is turned slightly to their left or to our right. And so this is the anterior surface here, but it's turned slightly away from us to the patient's left, to our right. In the thoracic section, the vertebral bodies are, while larger than the cervical, are a bit smaller than the lumbar. And also you'll notice that the transverse processes point a little bit posteriorly to allow for the ribs. And then also the spinous process, although it looks very similar here to some of the other spinous processes, if you look at it from the lateral picture, you'll notice that those spinous processes have a inferior pointing direction. So as they come off of the back of the lamina, they start to move inferiorly as well as posteriorly at the same time. So take a look at those spinous processes to help you distinguish whether it is a cervical, thoracic, or lumbar. And then also we have the articulating surfaces for the ribs. So we have the superior costal facet here and the transverse costal facet here. So they attach at the vertebral body and then come around and touch on the transverse process and then wrap around to the front of the body. And if you'll notice on this lateral picture here, so this is the anterior side of the patient and the posterior side of the patient, you've got a superior costal facet and an inferior costal facet. So if this is, and this is the T6 vertebra, this is the T6 vertebra, this is the T6 rib that would be coming off of it and touching in those two places, but it also will touch the T5 vertebra, and you can see that a little bit here. So this is T7, this is the 7th rib. It's not only touching the T7 vertebral body, but it will be touching the T6 one sitting right above it. And here on the T8 rib, or the 8th rib, is touching both T8 and T7 right here. So that's something to notice. The thoracic spine forms a kyphotic curve, which means that it is concave anteriorly. And we will look at the curves of the spine more closely in a later slide. And we had studied the lumbar earlier, so we'll move on to the sacrum. The sacrum articulates with a lumbar spine superiorly and with the ilium, the large wings of the hip bones here, laterally, and that's the SI joint, and then with the coccyx inferiorly. So you've got the coccyx attaching to the inferior side of the sacrum. And then you have the sacral foramina, and this is for the nerve roots to run through. And the vertebral bodies of the sacrum are fused. So you can see that they don't have any space between them and no disc spaces, or very little disc spaces. If you see here on the lateral view, they're very small, not very prominent at all, not offering much cushion there, just a nice strong bone to help support the pelvis. And this is also a kyphotic curve, so this is like the thoracic spine in that it concaves anteriorly. So this is the posterior surface, this is the anterior surface, and it's a kyphotic curve. This image on the left here shows the normal curvatures of the spine. So they alternate in the curvature. You have the cervical lordosis, the thoracic kyphosis, the lumbar lordosis, and the sacral kyphosis. And when you're using the word just in determining what type of curve it is, as in lordosis, in this way, cervical lordosis, it just means the curve. But when you actually put it in capital letters as a disease process or a condition, lordosis means abnormal anterior curvature of the cervical or lumbar region. So here you're seeing lordosis because this woman is pregnant, and so she has an abnormal curvature of the back. You also sometimes will notice gymnasts will have this. And then an abnormal kyphosis, or kyphosis with a capital K, is an abnormal kyphotic curve where it is very prominent. And then scoliosis is an S curve laterally, side to side, and you can see that here in this image below from Netters, the abnormal curvature side to side, left to right, and it sometimes will also twist. So along with the curve, it may also twist. There are two very important ligaments that support the spine. The anterior longitudinal ligament runs along the anterior part of the vertebral bodies, and the posterior longitudinal ligament runs just posterior to the vertebral body, and that's anterior to the spinal cord and anterior to the CSF space that surrounds the spinal cord. So those are two very important ligaments. Also of note here, I want to show you how the spinal nerve runs out the intervertebral foramen. And so when you're doing axial slices in MRI or in CT, if you set up axial slices there for CT, you want to be sure that you get through the whole foramen as it's showing this nerve exiting. And if that nerve is pinched at any point in time, you'll want to see that. So you want to make sure that you cover the whole foramen. And we covered this in an earlier slide, but the intervertebral disc contains the annulus fibrosus, which is the supporting fibers around the outside of the disc, and then the Nucleus pulposus is the gelatinous pulp center. And when it herniates, you can take a look at that image here. When it herniates, sometimes that nucleus pulposus kind of squirts out in between the annulus fibrosus fibers. And you can see how that can put pressure on the nerve root. So you can take a look for those on an axial MRI. And in the next slide, you can see that happening here, and you can see how that pushes that posterior longitudinal ligament out of the way and pushes it away from the vertebral body when that happens. You can see that in this image as well. And that is our lecture on the vertebral bodies of the spine.